Good day, everyone. Welcome to Clinical Chemistry 1. For our first laboratory topic, we will be discussing the laboratory safety rules and regulations. At the end of this lecture, we will be able to define the difference between the universal precautions from standard precautions. We'll also be able to enumerate and explain the different health practices, the laboratory safety rules and regulations in the clinical laboratory, specifically clinical chemistry laboratory. We'll also be able to identify the different steps involved in the contamination and disposal of wastes, explain the importance of hand washing because I think you already mastered hand washing because you've been doing this since PMLS up until this time. So by this time, you can be able to explain its importance. Next is to practice the steps of proper donning and doffing of your personal protective equipment. Enumerate the different safety equipments found in the clinical chemistry laboratory. Also, enumerate and differentiate the different types of hazards emanating in the laboratory. So, we all know that there are a lot of potential risks and hazards inside the laboratory. And lastly, to summarize the significance of laboratory waste management. As clinical laboratory personnel class, we all know that the nature of the work and the things that we perform inside the laboratory, we are exposed daily to the different potential hazards, not just limited to the contagious and infectious body fluids, right? But we can also be exposed to the different electric shock, the inhalation of toxic vapors from the reagents that we use from the laboratory. There could also be compressed gases, flammable liquids, radioactive material, corrosive substances. Can also be mechanical trauma because we use needles and sharps inside the laboratory. So when we have needle prick, that's considered to be a mechanical trauma. Also poisons and the inherent risk of handling the different biologic materials. That's just to name a few of the potential hazards that is found in the laboratory. We are expected to develop an understanding of the risk associated with these following hazards, and we are always reminded to be safety conscious at all times. If you can remember in my discussion with the PMLS one regarding biosafety and biosecurity, we are always informed of the different hazards and we have to recognize them so that we will be able to prevent them or as much as possible eliminate those types of hazards. That's why, class, in every section of the laboratory, there's always this universal precaution must be observed that is posted there. That is to always remind us to be cautious at all times. In 1996, the universal precautions and the guidelines were updated and later renamed as standard precautions. So, standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non intact skin that includes rashes, and also the mucous membranes. As you can see from this diagram here, the four it's placed here as five, but the four standard precautions includes hand hygiene, the use of personal protective equipment such as gloves, mask, eyewear, also respiratory hygiene or the cough etiquette, also sharps safety that includes engineering and work practice controls. The video that I will be showing you right now, class, is the steps on proper hand washing. Since we will be having a proficiency examination regarding this, I will be uploading a checklist of the steps on how to properly wash your hands. So this means you have to familiarize, if not memorize, the different steps for you to master the proper hand washing. Actually, in this video, it's a little short, but there are a lot of videos online class that shows the proper hand washing that includes scrubbing of your fingers or fingernails. So you have to follow that. Don't worry, I will be uploading a checklist for this so that you have a guide. So when do you exactly wash your hands? There are different moments where you are required to wash your hands. Those are the times when you touch blood, body fluids, secretions, excretions, and any items considered contaminated. Also, there are also other moments where you are required to wash your hands. That is after you touch, you don and you doff your PPE. And at the same time, when you meet and touch in between patients. So before you get inside the room of your next patient, you need to wash your hands. And after you touch or you deal with that patient, you also need to wash your hands. So those are the moments where you need to wash your hands. We're very much informed that hand contact is a primary method of infection transmission. That is why laboratory personnel must always wash hands during these times when your gloves are removed prior to leaving the work area. Anytime when you feel that your hands are contaminated, as much as possible, you wash your hands every now and then. Also, before going to designated break areas or when you're going to eat your meals or snacks, and before and after using bathroom facilities. This checklist here, class, is from the World Health Organization and also Centers for Disease Control and Prevention. Here is the checklist on how to properly wash your hands. So, in order for you to ace that proficiency examination, then you need to memorize the different steps on how to wash your hands. So, first, you wet your hands with water, of course, then apply enough soap to cover all the hand surfaces. You also rub your hands palm to palm and then over and interlacing the fingers. Again, palm to palm with fingers interlaced. You also scrub the fingers, the thumbs, and you rinse with water. After that, you dry your hands thoroughly with a single use towel or a tissue paper. Then you use that same towel to turn off the faucet, and this time your hands are now safe. Additional notes before we proceed. A routine hand washing procedure uses plain soap and water to mechanically remove soil and transient bacteria. A 2-minute surgical hand scrub uses an antimicrobial soap or any equivalent to destroy transient bacteria and reduce levels of normal flora prior to surgical procedures. A good lather or foam is needed to reach all the surfaces. Scrubbing is necessary to dislodge microorganisms from surfaces, especially between fingers and around the knuckles. Clean hands should not touch contaminated faucet handles. That is why, as what I've said a while ago, you have to use the towel or that tissue paper to turn off the faucet. Another very important PPE to be used in the laboratory are gloves. This should always be worn when handling blood, body fluids, secretions, excretions, and any items considered contaminated. Remember, class, the laboratory gloves are not puncture proof. That is why you're still advised to take extra precaution when using your gloves, especially when you're dealing with sharps or needles. The mask, the eye protection, and the face shields must be worn anytime when there is potential for splashes or sprays of blood, body fluids, secretions, and excretions. This one class over here that is found on the left side of your screen, this is called the hazmat. Aside from your laboratory coats, you're expected to wear closed shoes that would protect the skin around your feet. This one here is the laboratory coat. This must be worn at all times to protect skin and clothing when in contact with blood, body fluids, and secretions or excretions. During phlebotomy class, we're always advised that used needles should not be recapped, bent, or broken by the medical technologist on duty or the phlebotomist. That is to prevent needle stick injury from happening. And in the laboratory, we're always provided by tight-fitting, puncture-proof, heavy-duty, leak-proof sharps disposal containers. So after you extract blood from your partner, from your classmate, or from your patient, then you are expected to throw all those needles, not recapped, not bent or broken, inside this sharps disposal container. It is of utmost importance that any cuts or scratches be well protected from contamination with blood, body fluids, secretions, and excretions. So, as much as possible, if you have wounds, open wounds, scratches, you cover them, especially when you work inside the laboratory. That is to prevent any contamination and infections on your end. This is very true. Needle sticks and other sharps related injuries may expose workers to blood-borne pathogens. Aside from bacterial infections, you could also acquire human immunodeficiency virus or HIV that could probably lead to AIDS. So, God forbid. Also, you could get hepatitis B virus out from this, and also hepatitis C virus infection. So, as much as possible, you have to be extra precautious inside the laboratory. All the specimens for centrifugation must be centrifuged in a closed tube. So, you do not centrifuge tubes that are open top, huh? So you also make sure that when centrifuging class, it is balanced, it is well balanced. That's to prevent the centrifuge from agitating and from falling from the table. All pipetting must be carried out using mechanical pipette devices. Do not worry, class, we will be having a separate laboratory activity regarding pipetting so that you can also practice and have a grasp on how to properly hold your pipettes and at the same time dispensing the fluids using the pipettes. Any instrumentation must be decontaminated prior to servicing. This one class is done to prevent carryover of the biological items or the cross contamination of biologic substances. The contamination class is actually a combination of processes that removes or destroys contamination so that infectious agents or other contaminants cannot reach a susceptible site in sufficient quantities to initiate infection or other harmful response. A bleach or phenolic disinfectant is the most common disinfectant used in the clinical laboratory. Phenolic disinfectants, these are a combination of phenolic compounds and detergents and can be purchased commercially. When there are spills class, when spills occur, the contaminants are used to neutralize the biological hazard and to facilitate its removal. You allow the spill to be absorbed and pour 0.5% bleach over the towels. After that, you carefully pick up the bleach soak towels and transfer them into an infectious waste receptacle. Need to contaminate again the spill area with 0.5% bleach and clean it with a phenolic detergent if you desire. All disposable materials used to clean the spill area must be placed in an infectious waste receptacle and must not be reused. In the disposal of waste class, we must protect at all times not just the laboratory personnel, but that also includes the maintenance staff. That is why we have to adhere to the infectious waste disposal policy. The used gloves, masks, evacuated tubes, and visibly soiled tourniquets must be disposed in a clean yellow biohazard bag. Remember, that's clean yellow biohazard bag. For used syringe, needles, lancets, and glass slides, this must be disposed in the sharps container. So that's in the sharps container. While for those soiled items or PPE, that's in a clean yellow biohazard bag. While those that can cause mechanical trauma, such as syringes, needles, that's in the sharps. Urine may be discarded directly down a sink or toilet. The sink must be well rinsed with water after discarding the specimens, and at least you have to clean it daily with 0.5% bleach or sodium hypochlorite. It says here, class, it's zero point 0.5 bleach, but almost all the other references that I have read, they made use of 10% bleach. So during the examinations, don't worry if we have 0.5% or 10%, either of the two are correct. Emptied urine containers are to be disposed again in the yellow biohazard bag. The other infectious waste must be incinerated or autoclaved before we dispose of it. In this slide here, class, these are the recommended steps for putting on and putting off the personal protective equipment. So for donning, that is when we wear our PPE. First, we have to perform hand hygiene. That's the most important before we touch our PPE. Perform hand hygiene and then put on the laboratory gown. You have to tie the neck area and the waist tie securely so that your gown will not fall off later on. Next is to put on the mask or the N95 respirator. So after hand hygiene, wear your gown, put on mask. Next is to put on the protective eyewear. You have to adjust it so that it will not obscure other functions of your personal protective equipment. And lastly, you put gloves. Put on gloves before getting inside the room of the patient. So those are the steps for donning. Well, for the recommended steps of taking off your personal protective equipment here is first, you have to remove the gloves. Remove the gloves without touching the contaminated area. So if there's a way for you to remove your gloves without touching the outside portion of the gloves, then you have to do so. Next is to perform hand hygiene if there are sink or there are alcohol sanitizers inside the room of the patient. You have to remove the, you have to sanitize your hands. And then you remove your gown. So after you remove your gloves, you remove your laboratory gown. Still the same. Make sure you do not touch the contaminated area or the outside portion of the laboratory gown. After that, you perform again hand hygiene. So after your gloves, you can do hand hygiene in between, laboratory gown, hand hygiene in between, and then removing your eye protection before you touch the mucousy areas of your face, such as your nose and your eyes and or mouth. You have to wash your hands. So removing your eye protection and removing the mask. So you remove the mask or the N95 respirator and then perform again hand hygiene. As much as possible, you have to perform hand hygiene at all times. On the left here, class, you can see that this is a complete personal protective equipment picture. So these items here, class, are used to protect the phlebotomist or the laboratory personnel from infectious material from contacting to street clothes, the skin, or the mucous membranes. Hence, we have to use the PPE at all times inside the laboratory, and it's very important. This picture here, class, is the sequence or the steps for putting on the personal protective equipment. As much as possible, you can also memorize this just to be ready for any proficiency examination. This photo here is the steps on how to safely remove your personal protective equipment. These are diagrams or steps provided by the Centers for Disease Control and Prevention as well as the WHO. So these are also the same checklist that we will be using for the proficiency examination if there is any. Additional notes, the use of a personal protective equipment is mandatory and mandated by the Department of Health to minimize exposure not just to bloodborne pathogens, but all the infectious pathogens that are available. You have to don the PPE before contact with any patient, generally before entering the patient's room. Also, use PPE carefully to avoid spreading contamination. You have to properly fit your PPE. That's very important for our safety. And if ever the gloves provided for you are too small or too large, make sure to change it and adjust or to use a gloves that are of your size. These are the different laboratory safety rules that is found inside the clinical laboratory. I know this has already been inculcated in our hearts and in our minds, but just to remind us again that we have to always dress appropriately inside the laboratory. Remember, class, to always wear closed shoes in cases of accidental spills and sprays. That is to protect the skin of our feet in that area over there. Also, proper supervision inside the laboratory. You do not perform any laboratory experiments without your instructor, or if you're a new medical technologist, you do not perform without prior supervision. That means you have to be reoriented to the procedure. Also, no location of emergency numbers and safety equipment. This means, class, you have to know the location of the showers inside the lab, where are the eye washes, the fire extinguishers as well. Also, no food. You're not allowed to eat or drink inside the laboratory. You also need to identify the different hazards and risks inside the lab. Be attentive at all times. So this means that you have to be alert at all times and at the same time cautious, and you need to have a common sense. Next is be careful when handling hot glassware. So you might accidentally spill something and that break any glassware inside the laboratory. Keep a clean workspace. Medical technologists are known to be very OC, so we have to clean at all times our area. Handle glassware carefully and always clean up. Dispose of your waste, your trashes, and at the same time, proper hand hygiene. These are the same important laboratory safety rules that I have discussed prior to this. Laboratory safety necessitates the effective control of all hazards that exist in the clinical laboratory at any given time. That is why safety begins with the recognition of hazards and is achieved through the application of common sense, a safety focused attitude, your good personal behavior, good housekeeping in all laboratory work and storage areas, and above all, the continual practice of good laboratory technique. In most cases, class, accidents can be traced directly to two primary causes. Presented here are the primary causes of accidents inside the laboratory. Number one is the lack of understanding when working with hazards, the improper or unintended use of the equipment, and inexperienced medical technologists or laboratory personnel, distraction or lack or loss of attention to tasks. Also, the broken, damaged glassware or equipment. The Public Law 91596, or better known as the Occupational Safety and Health Act, was enacted by the U.S. Congress in 1970. The main goal of this federal regulation is to provide all the employees, clinical laboratory personnel included, with a safe work environment. Under this legislation, the Occupational Safety and Health Administration, also known as OSHA, is authorized to conduct on site inspections to determine whether an employer is complying with the mandatory standards. Remember, class, safety is no longer only a moral obligation but also a federal law. OSHA standards also regulate safety in the laboratory, include laws such as, kindly write this down because I did not place it in my PowerPoint. You write this down. The bloodborne pathogen standard, formaldehyde standard, laboratory standard, the hazard communication standard, respiratory protection standard, air contaminant standard, and personal protective equipment standard. Just to give you an overview of the bloodborne pathogen, that's this standard applies to all exposure to blood or other potentially infectious materials in any occupational safety. There are also other federal regulations relating to laboratory safety, such as the Clean Water Act, the Resource Conservation and Recovery Act, the Toxic Substances Control Act. In addition, clinical laboratories are required to comply with applicable local and state laws, such as fire and building codes. The Clinical and Laboratory Standards Institute, formerly known as the National Committee for Clinical Laboratory Standards, provide excellent general laboratory safety and infection control guidelines in their documents, such as the GP 17A2, that's the Clinical Laboratory Safety Approved Guideline. Also, there's M29A3. That's protection of laboratory workers from occupationally acquired infections, approved guideline. The safety is also an important part of the requirements for initial and continued accreditation of healthcare institutions and laboratories by voluntarily accrediting bodies such as the Joint Commission, formerly known as the Joint Commission on Accreditation of Healthcare Organizations. And there's also the Commission on Laboratory Accreditation of the College of American Pathologists. The employer and the employee class share safety responsibilities. So, not just the employees, the employer also has responsibilities to comply. The employer's responsibilities include establish laboratory work methods and safety policies. They provide supervision and guidance to employees. They also provide safety information, training, PPE, and medical surveillance to their employees. And to provide and maintain equipment and laboratory facilities that are free of recognized hazards and adequate for the tasks required. Again, while the individual employee has an obligation to follow safe work practices and be attentive at all times to potential hazards, our employers has the ultimate responsibility for safety and delegates authority for safe operations to laboratory managers and supervisors. The employee, on the other hand, also has a responsibility for his or her own safety and the safety of their coworkers. Employee conduct in the laboratory is a vital factor in the achievement of a workplace without accidents or injuries. So, below here, class, are the employee's responsibilities. That's to know and comply with established laboratory work safety methods or practices, also has a positive attitude towards supervisors, co-workers, facilities, and safety training. Be alert and give prompt notification of unsafe conditions or practices to the immediate supervisor and ensure that unsafe conditions and practices are corrected. And lastly, to engage in the conduct of safe work practices and the use of personal protective equipment. This one class is the hazardous materials classification signage. And appropriate signs to identify hazards are very critical, not only to alert laboratory personnel to potential hazards, but also to identify specific hazards that may arise because of emergencies such as fire or explosion. The National Fire Protection Association, NFPA, developed a standard hazard identification system. This one class is a diamond shaped color coded symbol, which has been adopted by many clinical laboratories. By just looking at it, class, emergency personnel can assess health hazards. So, health hazard for the blue quadrant, the flammable hazards, that's for the red quadrant. There's also the reactivity or stability hazards that's found on the yellow quadrant, and other special information that's found in the white quadrant. In addition, class, there also in each quadrant here, you can see that it shows the magnitude of severity graded from low 0 to a high of 4. So you can see that in here, that is posted in this hazardous materials classification. This one is another diagram of the NFPA rating explanation guide. So do not forget, class, the ratings from 0 to 4 of the different quadrants, the health, flammability, and instability hazards. For this special hazard here, class, there are symbols such as OX or OX for oxidizing, SA for simple asphyxiants, while the W with a strike through, that means reacts violently or explosively with water. All in-house prepared reagents and solutions should be labeled in a standard manner and include the chemical identity, concentration, hazard warning, special handling, storage conditions, the date when that solution is prepared, the expiration date if it's applicable, and also the preparer's name or the preparer's initials. These are the different safety equipments that I have mentioned earlier, and this has been developed specifically for use in the clinical laboratory. The employers class are required by law to have designated safety equipment available, but it is also the responsibility of the employee to comply with all safety rules and to use safety equipment. All the laboratories are required to have safety showers, eye wash stations, and fire extinguishers, and to periodically test and inspect those equipment. It is recommended that safety showers deliver 30 to 50 gallons of water per minute at 20 to 50 pounds per square inch and be located in areas where corrosive liquids are stored or used. So those are the things you need to know for safety showers. While the eye wash stations must be accessible, like around within 100 feet or yes, 100 feet in laboratory areas presenting chemical or biological exposure hazards. Other items that must be available for personnel include fire blankets, spill kits, and first aid supplies. Mechanical pipetting devices must be used for manipulating all types of liquids in the laboratory, including water. Always remember, class, mouth pipetting was done before, but that's history. But right now, mouth pipetting is strictly prohibited. Chemical fume hoods and biosafety cabinets. As for fume hoods class, they're required to contain and expel noxious and hazardous fumes from chemical reagents. Fume hoods should be visually inspected for any blockages. A piece of tissue paper placed at the hood opening will indicate airflow direction. The hood should never be operated with the sash fully opened, and a maximum operating sash height should be established and conspicuously marked. The containers and equipment positioned within hoods should not block airflow. Periodically, ventilation should be evaluated by measuring the phase velocity with a calibrated velocity meter. As an added precaution, smoke testing is recommended to locate no flow or turbulent areas in the working space, and personal air monitoring should be conducted in accordance with the chemical hygiene plan of the facility. As for biosafety cabinets, they remove particles that may be harmful to the employee who is working with potentially infectious biologic specimens. The Centers for Disease Control and Prevention and the National Institutes of Health have described four labels of biosafety. Remember the four different biosafety levels that I taught to you during your PMLS 1? This consists of combinations of laboratory practices and techniques. The safety equipment and laboratory facilities are included in those biosafety levels. The biosafety level of a laboratory is based on the operations performed, the routes of transmission of the infectious agents, and the laboratory function or activity. Accordingly, biosafety cabinets are designed to offer various levels of protection depending on the biosafety level of the specific laboratory. These are the biologic safety general considerations. I have already mentioned this a lot of times a while ago. Kindly read this down for me. I also have discussed spills earlier, and as what I have said, there is a reference that says 0.5% bleach in neutralizing the spills, but you could also disinfect it with 10% bleach. And you may use the appropriate contact time with the 10% bleach. In this diagram here, class, you can see the different universal precautions that must be taken into consideration when doing all the things inside the laboratory. In December 1991, OSHA issued the final rule for occupational exposure to blood-borne pathogens. To minimize employee exposure, each employer must have a written exposure control plan. The plan must be available to all employees whose duties may result in reasonably anticipated occupational exposure to blood or other potentially infectious materials. The exposure control plan must be discussed with all employees and be available to them while they are working. The employee must be provided with adequate training in all techniques described in the exposure control plan at initial work assignment and annually thereafter. All necessary safety equipment and supplies must be readily available and inspected on a regular basis. Clinical laboratory personnel are knowingly or unknowingly in frequent contact with potentially biohazardous materials. So, in recent years, new and serious occupational hazards to personnel have arisen, and this problem has been complicated because of the general lack of understanding of the epidemiology, mechanisms of transmission of the disease, or inactivation of the causative agent. Special precautions must be taken when handling all specimens because of the continual increase in the proportion of infectious samples received in the laboratory. Therefore, in practice, specimens from patients with confirmed or suspected hepatitis, acquired immunodeficiency syndrome or AIDS, or other potentially infectious diseases should be handled no differently than other routine specimens. Adopting a universal precautions policy, which considers blood and other body fluids from all patients as potentially infective, is required. Because of a global resurgence of TB, OSHA issued a statement in 1993 that the agency would enforce CDC guidelines for preventing the transmission of tuberculosis in healthcare facilities. Also, there's an epidemic for COVID-19. So, of course, no, there are stricter policies regarding the use of PPE as well as the proper um, dealing with those types of specimens. The purpose of the guidelines is to encourage early detection, isolation, and treatment of active cases. Those workers in high risk areas may be required to wear a respirator for protection, and all healthcare workers considered to be at risk must be screened for TB infection, and the latest is COVID-19. Other specific pathogens, including viruses, bacteria, and fungi, may be considered airborne transmission risks. Protective measures in the clinical laboratory generally involve work practice and engineering controls, focus on prevention of aerosolization, containment, isolation, and respiratory protection of N95. For chemical safety, the clinical laboratories must plan and implement a written hazard communication program. Obtain a safety data sheet or MSDS, the material safety data sheets for each hazardous compound present in the workplace, and have the MSDS readily accessible to employees. Educate all employees annually on how to interpret chemical labels, safety data sheets, and health hazards of the chemicals, and how to work safely with the chemicals. Also, to maintain hazard warning labels on containers received or filled on site. The material safety data sheet class, the photo of this is after this slide. So, this is a major source of safety information for employees who may use hazardous materials in their occupation. The employers are responsible for obtaining the safety data sheets from the chemical manufacturer or developing an SDS for each hazardous agent used in the workplace. A standardized format is not mandatory, but all requirements listed in the law must be addressed. In here, class, written here on this right side of the screen, you can see the summary of the SDS information requirements. So these must be seen in the safety data sheet, all of this. So this photo here, the one on the left and also the one on the right, these are examples of material safety data sheets. This one is for acetone and the other one is for Clorox bleach. So all the necessary information that needs to be transparent must be seen in the material safety data sheet. It must be seen all here. To avoid accidents when handling chemicals, it is important to develop respect for all chemicals and to have a complete knowledge of their properties. This is particularly important when transporting, dispensing, or using chemicals that, when in contact with certain other chemicals, could result in the formation of substances that are very toxic, can also be flammable or explosive. For example, class acetic acid is incompatible with other acids such as chromic and nitric acid. Carbon tetrachloride is also incompatible with sodium. And flammable liquids are incompatible with hydrogen peroxide and nitric acid. So you have to make sure that arrangements for the storage of chemicals will depend on the quantities of chemicals needed and the nature or type of the chemicals. Proper storage is essential to prevent and control laboratory fires and accidents. Ideally, the storeroom should be organized so that each class of chemicals is isolated in an area that is not used for routine work. An up-to-date inventory should be kept that indicates location of chemicals, the minimum or maximum quantities required, and its shelf life. Some chemicals class deteriorate over time and can become hazardous. Let's say, for example, ethers and tetrahydrofuran, they form explosive peroxides. So storage should not be based solely on alphabetical order because incompatible chemicals may be stored next to each other and react chemically. So they must be separated for storage. So this one here, this table here shows the different substances that can be stored together, while this area here are the substances that must be stored separately. You also need to familiarize the different chemical hazard symbols. In this way, it will be easier for you to identify what type of hazard that might be. So make sure you remember the photos. This might go out in the examination, the photos only. Then you're asked to identify what are these photos. So these are the chemical hazard symbols. I know this has been discussed to you with histopathology already, but let's just have a brief recap. For flammable or combustible chemicals, these are actually liquids that are used in numerous routine procedures and among the most hazardous materials in the clinical chemistry laboratory because of possible fire or explosion. They're classified according to flash point. Remember the flash point? Which is the temperature at which sufficient vapor is given off to form an ignitable mixture with air. So that's the meaning of flash point. A flammable liquid has a flash point flammable below 37.8 degrees Celsius or 100 degrees Fahrenheit. While combustible liquids, by definition, have a flash point of above 37.8 degrees Celsius or 100 degrees Fahrenheit. Some commonly used flammable and combustible solvents are acetone, benzene, ethanol, heptane, isopropanol, methanol, toluene, and xylene. It is important to remember that flammable or combustible chemicals also include certain gases, such as hydrogen and solids, and can also include paraffin. So, in order for you to remember, flammable liquid, flash point below, while combustible liquids, flash point above. Remember, C comes first before F. So C is above, F is below. C comes first from than F. For corrosive chemicals, these are injurious to the skin or eyes by direct contact or to the tissue of the respiratory and gastrointestinal tracts if inhaled or ingested. Typical examples include the acids, acetic, sulfuric, nitric, and hydrochloric. Also bases, ammonium hydroxide, potassium hydroxide, and sodium hydroxide. External exposures to concentrated corrosives can cause severe burns and require immediate flushing with copious amounts of clean water. As for reactive chemicals, these are substances that under certain conditions can spontaneously explode or ignite or that evolve heat or flammable or explosive gases. Some strong acids or bases react with water to generate heat, so that's exothermic reactions, while hydrogen is liberated if alkali metals such as sodium or potassium are mixed with water or acids, and spontaneous combustion may also occur. The mixture of oxidizing agents such as peroxides and reducing agents such as hydrogen generates heat and may be explosive. Carcinogens are substances that have been determined to be cancer-causing agents. OSHA has issued lists of confirmed and suspected carcinogens and detailed standards for the handling of these substances. An example of this is benzidine. If possible, a substitute chemical or different procedure should be used to avoid exposure to carcinogenic agents. Next would be fire safety. Remember, class, fire is basically a chemical reaction that involves the rapid oxidation of a combustible material or fuel with the subsequent liberation of heat and light. In the clinical chemistry laboratory, all the elements essential for fire to begin are present. So that's fuel, heat, or the ignition source, heat or the ignition source, and oxygen or the air. However, recent research suggests that a fourth factor may be present. And this factor has been classified as a reaction chain in which burning continues and even accelerates. It is caused by the breakdown and recombination of the molecules from the material burning with the oxygen in the atmosphere. Fires have been classified already into four different classes. So that's class A, that's for ordinary combustible solid materials such as paper, wood, plastic, and fabric. For class B, that's flammable liquids or gases and combustible petroleum products. For class C, these are fires involving energized electrical equipment. While for class D fires, that's combustible or reactive metals such as magnesium, sodium, and potassium. And lastly, for class K, these are fires that involves cooking appliances, combustible cooking media, vegetable or animal oils, and fats. Aside from the classification of fires and what type of fire does that compose of, there are also different types of extinguishers that are identified. So just as fires have been divided into classes, fire extinguishers are also divided into different classes that correspond to the type of fire to be extinguished. Be certain to choose the right type because using the wrong type of extinguisher may be dangerous. For example, do not use water on burning liquids or on electrical equipment. Remember, water class is a conductor of electricity. So that might the person doing or extinguishing the fire might be electrocuted na noon. So, right, no? Pressurized water extinguisher as well as foam and multipurpose dry chemical types are used for Class A fires. Multipurpose dry chemical and carbon dioxide extinguishers are used for Class B and C fires. Halogenated hydrocarbon extinguishers are particularly recommended for use with computer equipment. Class D fires present special problems and extinguishment is left to trained firefighters using special dry chemical extinguishers. Generally, all that can be done for a Class D fire in the laboratory is to try and isolate the burning metal from combustible sources with sand or ceramic barrier material. Personnel should also know the location and type of portable fire extinguisher near their work area and know how to use an extinguisher before a fire occurs. In the event of a fire, first evacuate all personnel, patients, and visitors who are in immediate danger, and then activate the fire alarm. Report the fire, and if possible, attempt to extinguish the fire. Personnel should also work as a team to carry out emergency procedures. Fire drills are done, must be conducted regularly and with appropriate documentation. These are the healthcare fire safety. The acronym RACE, Rescue, Alarm, Contain, Extinguish, is taught to schools, not just in the healthcare facilities. These are the four essential steps to take if you discover a fire. So the acronym is RACE. While to properly operate a fire extinguisher, the acronym used is PASS. That's pull, aim, squeeze, and then sweep. So that's how to properly operate a fire extinguisher. Always remember this class, huh? For electrical hazards, of course, no. Most individuals are aware of the potential hazards associated with the use of electrical appliances and equipment. Direct hazards of electrical energy can result in death, shock, or burns. Indirect hazards can result in fire or explosion. Therefore, there are many precautionary procedures to follow when operating or working around electrical equipments. So, number one, you use only explosion rated, intrinsically wired equipment in hazardous atmospheres. Be particularly careful when operating high voltage equipment such as electrophoresis apparatus. Use only properly grounded equipment. So the three-prong plug. The three-prong plug is the most common properly grounded equipment in the laboratory. Check for frayed electrical cords. Promptly report any malfunctions or equipment producing a tingle for repair. Do not work on live electrical equipment. Never operate electric equipment with wet hands. Know the exact location of the electrical control panel for the electricity to your work area. Use only approved extension cords in temporary applications and do not overload circuits. Have ground, polarity, and leakage checks and other periodic preventive maintenance performed on outlets and equipment. In addition to physical hazards such as fire and electric shock, laboratory personnel should be aware of the mechanical hazards of equipment such as centrifuge, autoclaves, and homogenizers. Centrifuge, for example, class must be balanced to distribute the load equally. The operator should never open the lid until the rotor has come to a complete stop. Safety interlocks on equipment should never be rendered inoperable. Laboratory glassware itself is another potential mechanical hazard. Agents such as glass beads or boiling chips should be added to help eliminate bumping oil or boil over when liquids are heated. Tongs or insulated gloves should be used to remove hot glassware from ovens, hot plates, or water baths. Glass pipettes should be handled with extra care, as should sharp instruments such as cork borers, needles, scalpel blades, and other tools. A glassware inspection program should be in place to detect signs of wear or fatigue that could contribute to breakage or injury. All infectious sharps must be disposed in OSHA-approved containers to reduce the risk of injury and infection. This diagram here, class, shows the 9 classes of hazardous materials. So kindly memorize them. Class 1 for explosives, Class 2 for gases, Class 3 flammable and combustible liquids, Class 4 flammable solids, spontaneously combustible and dangerous when wet hazardous materials, Class 5 for oxidizer and organic peroxide, Class 6 for poisonous or toxic and poison inhalation hazard, Class 7 for radioactive substances, Class 8 for corrosives, Class 9 for miscellaneous hazardous materials, and do not forget this sign here, dangerous. So that's the symbol for dangerous. It's even spelled out, so that's dangerous good. The safe handling and disposal of chemicals and other materials require a thorough knowledge of their properties and hazards. Generators of hazardous waste have a moral and legal responsibility as defined in applicable local, state, and federal regulations to protect both the individual and the environment when disposing of waste. There are 4 basic waste disposal techniques. That's flushing down the drain to the sewer system, the incineration, landfill burial, and recycling. In some cases, class, it is permissible to flush water-soluble substances down the drain with, copious amounts of water. However, strong acids or bases should be neutralized before disposal. The laboratory must adhere to institutional, local, and state regulations regarding the disposal of strong acids and bases. Foul-smelling chemicals should never be disposed of down the drain. Possible reaction of chemicals in the drain and potential toxicity must be considered when deciding if a particular chemical can be dissolved or diluted and then flushed down the drain. For example, sodium azide. Sodium azide is used as a preservative, but this forms explosive salts with metals such as the copper in our pipes. Many institutions ban the use of sodium azides due to this hazard. Other liquid waste, including flammable solvents, must be collected in approved containers and segregated into compatible classes. Also, before disposal, hazardous substances that are explosive and carcinogens should be transformed to less hazardous forms whenever feasible. If practical, solvents such as xylene and acetone may be filtered or redistilled for reuse. If recycling is also not feasible, disposable arrangements should be made by specifically trained personnel. Flammable material can also be burned in specially designed incinerators with afterburners and scrubbers to remove toxic products of combustion. As for medical waste, these are special waste from healthcare facilities and is further defined as solid waste that, if improperly treated or handled, may transmit infectious diseases. This comprises of animal waste, bulk blood and blood products, microbiologic waste, pathologic waste, and even sharps. The approved methods for treatment and disposition of medical wastes are the following: incineration, steam sterilization, burial, thermal inactivation, chemical disinfection, or encapsulation in a solid matrix. That is all for our first laboratory topic for laboratory safety rules and regulations. Thank you so much for taking the time to listen to this very long discussion, even if this is already a run through or a review for you. But please do not take your laboratory safety for granted. Once again, thank you so much for listening and have a blessed day.